Kidney disease is a silent disease. That's the problem. So many patients with kidney disease are not aware that they have kidney disease until it's very late. In the past, 10, 15, 20 years ago, we said there's no treatment for kidney disease. This no longer applies. There is now effective treatment for kidney disease. Well, the treatment of kidney diseases has changed in the past 10 years, especially with regards to the treatment of patients with diabetic kidney disease. So there are now new options. There are more medicine that are available to prevent worsening of the kidney disease. So in other words, patients with diabetes and kidney disease should have more opportunities to prevent their kidneys from worsening and to prevent dialysis or require a transplant. So the treatment of kidney disease has basically evolved from a time when little treatment was available to a time when there are many opportunities to prevent a patient from having failed kidneys. And this is particularly so for India. The Indian culture, and it is cultural. It is cultural for people to eat. It is cultural to, locally in India, to be a little on the overweight side. Well, other reasons for kidney disease would be autoimmune kidney conditions like glomerulonephritis, kidney stone disease in this part of the world, hereditary kidney diseases like polycystic kidney diseases, and of course there are congenital kidney conditions in the pediatric population. But between diabetes, glomerulonephritis, and polycystic kidney disease, you would basically cover most kidney diseases in the world. 50 to 60% of kidney diseases could be attributed to diabetes. 25 to 30% from glomerulonephritis, which are what we call autoimmune kidney diseases, and then you have the miscellaneous 5 to 10% from hereditary kidney diseases and kidney stones. So it varies a bit from country to country. Well, for most patients, kidney transplant is best mode of treatment for patients with kidney failure. I mean, of course you have dialysis, but dialysis is an inferior alternative. We are not talking about kidney transplant as improving just the quality of life. Kidney transplant increases the longevity of the patient. So if you have a patient with kidney failure, and if you have a kidney transplant, a successful kidney transplant basically approximately doubles the lifespan of the patient compared to a patient on dialysis. Well, the success of a kidney transplant has changed tremendously, has improved tremendously. In the past, we talk about maybe 10 years, the kidney transplant lasting 10 years in 50% of patients who have undergone a kidney transplant. Now we talk about a kidney transplant lasting 15 to 17 years in 50% of patients who undergo a kidney transplant. But being overweight carries with it the risk of diabetes and the risk of hypertension. So I see a lot of problems with diabetes now among patients from the Indian subcontinent. And it is important, and I remind them again and again, that excessive food becomes a poison. Excessive food is a poison. And the patients always laugh at me. They call me the doctor who says food is a poison. But truly, obesity, it's a killer. And obesity is because of food, of excessive food. Unhealthy food, carbohydrates, refined sugar, all this are entirely avoidable and preventable, so that one can steer away from obesity-related medical problems. There are no real specific restrictions. People talk about a lower protein diet, but that plays a very small role in kidney disease. Basically, I think it's still obesity. Obesity leading to diabetes, obesity leading to hypertension, and obesity alone, obesity per se, leads to kidney disease, even if you don't have diabetes. So obesity itself leads to a multitude of medical problems. Heart disease, hypertension, heart disease, joint diseases, musculoskeletal diseases, sleep apnea. I think obesity associated medical problems is not taken seriously. One should look into obesity, and I think if you reduce obesity, you will get rid of a lot of medical problems. Of course, if you have kidney stones, you need to drink more water if you have kidney stones, because water prevents kidney stones. But otherwise, excessive water drinking doesn't protect against kidney diseases. Vitamins certainly do not protect against kidney diseases. Supplements do not protect against kidney diseases.